This is Fiona McIntosh of Essential Osteopathy. I'm going to go through what osteopathy is, and I'm going to go through a normal treatment process. So what would happen if you came in the door first time? So osteopathy involves a number of treatment processes or modalities, including soft tissue massage, joint articulation and manipulation. So there are sometimes little clicks and pops, but not to worry, those are just joint releases, so nitrogen releasing from the joint. It's not appropriate for every patient at all, and it doesn't have to be done, but it's a good way of releasing the muscle tension and getting the joints moving. So we've got soft tissue massage, joint manipulation, we've got lots of types of stretching exercise, including muscle energy techniques and PNF techniques to try and release the muscles out. We also use visceral techniques to release out the organs. So you often have tension in the organs around the viscera that can also be accessed, and that can really help to release off both the muscle tension around the abdomen in this case, or indeed the fascia, which is the connective tissue surrounding and investing in all of our muscles and around the organs as well. We also have other techniques that we use, and in my case I do this. It's dry needling techniques, so it's like acupuncture. So it's basically acupuncture to release off the trigger points and help the body to relax and release off. And lastly, I also do cranial techniques, cranial osteopathy, and that's often used when we treat babies, and that can help with certain conditions, reflux, colic, this type of thing, that type of thing. But it's also used on adults, again, just to release off, get the body to relax and release the tension patterns throughout the body. So how do we treat? Right, so somebody comes through the door and they're going to be sitting with me. I'm going to go through what we call a case history. So that means we're going to just ask a number of questions, obviously clerical details to start with, and then we go on to just ask about that person's problem. So say they're presenting with low back pain, we're just finding out a little bit more about exactly where the problem is, and we'll talk a bit about what type of work that person does. Maybe we'll talk about what activities they do. Say they're a mother with a baby, then of course that's going to bring in different factors. Say they're a sports person, again, that's going to influence them greatly in other ways. So we're going to talk about that sort of context, if you like, of that pain. So find out a bit more about that. Say it was a knee problem, we would also be looking at the foot and how that's functioning, and the back and the hip indeed, on both sides, to see what is actually causing that knee pain. So sometimes it's not just down to the knee and the surrounding tissues. We have to look holistically at the whole body and how levels, say, of the pelvis, or indeed is the arch of the foot dropping, and is that causing or influencing in some way, say, that example of a knee problem. We then go on to talk a little bit about the general medical history of that person, so, of that patient. So it's important, again, just to put the whole back pain problem in context with their past, because in a lot of cases it's a cumulative effect, and so a lot of times it's about the end of the reservoir of compensation. So when you're born, you've got 100 points of compensation, so imagine a dam with 100, full of water, and as life goes on, you fall out of a tree when you're a kid, and various other incidents go on, whether they be emotional or physical, and you start to come down, so you only get 2 or 3 points left of that reservoir. Then it doesn't take much before you tip down to the zero and you become symptomatic. So often it's not just one incident that's caused the problem. So we then go on to talk through the rest of the case history, and there's not really much more to it after that point. So you've got the full context. I'm going to get you then to undress to your underwear. Now, again, you can bring shorts along, you can bring shorts and a t-shirt, whatever suits you, whatever you're comfortable with. But generally speaking, I like to look at what the spine is doing, and I'm going to get you to do some movements, standing to start with if possible, unless you're very acute, and then that will give me an idea of how the body's working. Then I basically get you to lie down on the plinth, and I do all the work from there. So I will examine, and I'll do a series of special tests really, depending what the problem is. And I'll be looking at how the spine is moving and how other joints are moving, and indeed what the muscle tension is like. We'll then talk through what I feel is what the diagnosis is. So I will tell you what the diagnosis is, and we'll go through the treatment plan from there on. And only at that point will I start treating, and we will then decide whether or not we go through to have further treatments. And I will also give advice and exercises that will give you just a bit of work that you can do outside to help really benefit you and really improve your symptoms. But just to remember that often the treatment process has to go side by side with a little bit of work that you might have to do outside of the treatment, outside of the clinic room. So that gives you a bit of idea of what osteopathy is and how we treat. In terms of, you might find after the treatment you might be a bit sore for a day or so, and then your symptoms should improve. Again, we often do need to get people back, depending on how long they've had the problem for or what the problem is exactly. So there might be return treatments. And so the first treatment is an hour long, and that involves a case history treatment, and the following treatments are half an hour long. So that gives you a bit of understanding of what actually happens when you come in to get treated at Essential Osteopathy.